Guys, we're going to talk about panic disorder today. And this is actually a topic I don't know much about. So Kibby is going to play the role of educating me as well as all of you. And then we're bringing Paul, my boyfriend, on again to discuss his awful experience with panic disorder that lasted 4 years. So he, I would say, has probably one of the more intense cases. And we'll hear from him. So the first question, so we actually put out a feeler on Instagram to see what your questions are about panic disorder. So the first question is just, please discuss what a panic attack is for those who've never experienced one. Okay, so the first thing that's important is that we're going to talk about panic attacks and panic disorder. Panic attack is basically a component of panic disorder. So you might be having tons of panic attacks, but you might not actually have panic disorder. But what a panic attack is an intense rush of anxiety where you suddenly feel very frightened or anxious and suddenly develop a lot of physical symptoms. And these symptoms come on really suddenly. They reach their peak within minutes. And the whole thing kind of varies in length, but I've heard of people with 15-minute panic attacks, 30-minute panic attacks, hour-long panic attacks. And the common symptoms that you might experience are your heart racing, pounding, or skipping, sweating, trembling, and shaking, being short of breath, feeling like you're being smothered, feeling like you're choking, feeling like you have chest pain or pressure. You might get nausea, upset stomach. You might feel dizzy, unsteady, like you might faint. You might have flushes, hot flashes, or chills. You might have tingling or numbness. And the symptoms that really freak people out and really kind of send the attacks over the edge are, there can be this feeling that this feeling of derealization, where basically it feels like you're an outside observer of your own thoughts and movements. You're kind of detached from your body or detached from reality in some weird way. You can feel like you're going crazy or might lose control. That is one of the scariest feelings associated. And the worst is this feeling that you're dying. And so a lot of people actually end up in emergency rooms when it's really a panic attack because they feel as though they're having a heart attack. So if you've experienced something like this that's got a few of these physical symptoms, you have likely had a panic attack.
Yeah, a lot of people throw around the word panic attack, the phrase panic attack, to describe like intense emotions, but panic attack itself, the way you just described it, is really specific. One supervisor told me it is the fear of fear. Mm-hmm. And I keep that in mind, fear of fear, because what happens is that a panic attack is actually a fear of your own symptoms, your own signs of fear. So if your heart starts to race, or you feel kind of out of breath, or feel a little shaky, and then if you have fear on top of that, if you can imagine, it'll just make it worse, right? It kind of like, if you're afraid of your own heart rate, what's going to happen? Your heart rate's going to go up super, super fast. Often a lot of people experience that feeling of going crazy or losing control, that feeling of, your body reacting with all the things you just said, like heart racing, feeling nauseous, choking, hard to breathe. And it comes on so quickly that, especially if it's unexpected or something that people don't know what it is, it can feel like a medical thing. It could feel like you're having a heart attack or you're going crazy, and people get really, really scared at that moment. And that coming on really quickly is one of the biggest signs that it's a panic attack, because there's a lot of people who do come in and say, yeah, I've had a panic attack. Mm-hmm. But they'll describe that feeling really upset or anxious for hours. They have a test coming up. They got an email from someone and they just got super, super upset, felt so anxious it was hard to breathe, and they started crying. Mm-hmm. So that's definitely like intense emotion. Like that's what it could feel like when anxiety gets really intense, right? But that's different than a panic attack, which it's like 0 to 60. It feels like within seconds. It just comes on and it's like, bam, you feel the symptoms. So really small nuances there. Both are kind of symptoms of really intense emotion, but panic attack is that fear of fear.
Yeah, it's amazing the people I've assessed. And first of all, I am surprised at how many people have had panic attacks. Mm-hmm. I mean, it really surprised me. Like, this is something, I have never had a panic attack. I have been very afraid before. I've been very anxious before. But like, my heart goes out to all the people in the world who have had, I mean, it's horrible. I guess you've had a panic attack.
Yeah.
It's just horrible.
Yeah. It's funny because I thought I've had panic attacks before. Like, I've had intense emotion where I've felt like it was out of control. So I was like, oh, I had a panic attack. But actually, the first time and only time I've had a true panic attack, I was actually talking to a supervisor about a patient who had a panic attack, which is so weird. And, it was bizarre. And as she was talking to me, it immediately felt like I couldn't hear as well. Like, my heart raced super fast, beat, 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 beat. And then I felt like someone muffled my ears. Mm-hmm. And I felt a little floaty, like, whoa, like it was a little dizzy. And I thought, oh my God, am I having a heart attack? Like, I'm going crazy. Oh no, maybe I had too much coffee. What's going on? And because it was so sudden and so intense so quickly that you're used to thinking that is like a medical emergency, right? Like something's truly wrong. Not just like I've been anxious for the whole day and something, it's just like bam. And I didn't expect it. It came out of nowhere. It's often, they come up in situations where you can't escape. So escape and being able to control the situation is major. So if you feel like you can't get out of there or you have to suppress it, right? If you feel fear, but you're like, oh, no, I have to keep my cool, that doubles, that it's more likely to trigger a panic attack because suppression of emotion makes emotions more intense. For all of you out there who express emotion, keep that in mind. But I was sitting there and I just felt like someone put earmuffs on me, and I was like, I'm going crazy. I got up, I had to get a drink of water. I felt like I wasn't in my body, and I came back in and I described what was happening to my supervisor, and she was like, oh, you're having a panic attack. And this, coming into like little tips of what to do when you see someone with a panic attack, she was like, feel your feet on the floor. She was doing grounding exercises. She was keeping me in the present moment, but directing my attention. So she was like, feel your feet on the floor. Feel the way your soles of the feet press into your shoes. Okay, feel your hands on the chair, right? And it took about an hour for me to come back too. But at that point, I had been assessing panic attacks for years. And still when it happened, I still thought, oh my God, I'm going crazy. Or I'm having a heart attack. So, yeah.
Yeah, I mean, one thing I've noticed with assessing people is that they so often are like, this came out of nowhere. Or, or maybe they were like anxious, but they weren't actually panicking from fear. Like I've heard so many times panic attacks on flights. And so there's some turbulence, they're getting anxious, and then all of a sudden there's a panic attack. And it's like, it didn't really ramp up in a normal kind of escalating fear way. It's like, it just all of a sudden just happened to them, like overcame them. And then that will sometimes then spark further panic attacks. Or another thing I've heard is like that panic attack will then almost start phobia. Does that ever happen?
Yeah, with fear and a lot of other intense emotions, but especially fear, it attaches and it gets associated with a situation very quickly, right? If you get really scared, you're going to learn really quickly what you're scared of, right? Because that's survival, right? So if you've been on a plane and it was super scary, and you had a panic attack, right? It could kind of attach to that experience of flying, right? So that's just the way anxiety and fear works. It kind of attaches quickly to like what sets it off, what triggers it. And if you think about that fear of fear, right? It becomes super sensitive because let's say, and it also can be something that you're not even aware of. If you have a really scary experience on a plane or in a car or, a dog or something, and you had a horrible experience with that, then even just like your heart rate or feeling out of breath can bring back that fear, can bring back that kind of panic response. So sometimes when people have panic attacks and then they go up a flight of stairs and they feel their heart rate and out of breath, and suddenly they'll have a panic attack. And they'll go, oh my gosh, I had a panic attack in my office. And so then it becomes really hard to go into the office because your anxiety brain thinks, okay, office is dangerous. But really what it is that you're afraid of your own feelings of fear.
Yeah. When you were having a panic attack, did you actually feel fear? Because I mean, it sounded like not necessarily. And the diagnostic criteria is an intense rush of anxiety, or so basically suddenly feeling very frightened or anxious, or suddenly developing a lot of physical symptoms. So is it even necessary for there to be an explicit fear component? Or is it the panic attack that freaks you out some of the time?
That's a really good question. I think what you're getting at is like, what is fear? And if my whole body was reacting like I was afraid, and my mind was trying to figure out what it was, and I didn't know what it was. So and that the feeling of out of control was very scary. So the whole experience was so scary. That I would think it's fear. But I'm also, it's hard for me to answer that because I'm really weird and I like really intense emotional experiences. So I barely remember this, but I kept saying to my supervisor, this is so cool. This is so cool. I'm going to be really happy that I had this experience. I've never experienced this before. Oh my gosh. And she was like, what? So I'm strange. So I think that probably took away the fear, my interest in the experience. So that could be a weird tip. Just get really interested in your own like frightening experiences, and that's a way to get over it. But
I actually think that's a good tip generally. That was what my mom told me, like when I was going through all of my angst after the bachelor, whatever. Just get interested in it. Just like
that's how you're a psychologist.
yeah. Me search. Okay, so we talked about what a panic attack is. So now we can distinguish it from panic disorder. So panic disorder, I mean, it contains panic attacks. Like, you're not going to have panic disorder without having panic attacks. But the difference is that some people can have a number of panic attacks, and it's not that they're okay with it, but they don't organize their lives around the panic attacks. If you've got panic disorder, you are doing a lot of avoiding. So you're kind of organizing your life around, I don't want to have another panic attack. What can I do to prevent that panic attack? So you might be carrying around, it might be simple things, carrying around a bottle of water all the time, Xanax all the time, avoiding coffee, avoiding exercise because those things get the heart rate up. Or it could be something way bigger than that, avoiding crowds, avoiding stores, avoiding being around other people, avoiding anything that gets your heart rate up. You might have to sit near doors or exits all the time, and so that can get, if you might avoid a lecture hall or something because there's no way to escape.
Yeah, so what you're describing, Jacqueline, is panic disorder often comes hand in hand with agoraphobia. So agoraphobia is a fear of being in public places or certain areas, right? So people are afraid to leave their homes. Because a lot of people are, they have a panic attack, it was really embarrassing, scary, they felt out of control in a public place, they might start to avoid public places like that, or places where you can't escape so easily, right? You can't run out when you're having a panic attack. And so they start to limit their life in order to avoid having a panic attack, right? So they can't go to concerts anymore. They can't be on buses or trains, right? So that's panic disorder with agoraphobia. The key thing of what you're saying is that there's a panic attack, but then there is avoidance and limiting your life based on the fear of having another panic attack. And that's really a principle of an experience that's really hard versus like developing a disorder, right? We could all have trauma, we could all have sadness, we could all go through different things, but if those experiences make us start to limit our lives or make us live not in line with our values, right? When you stop, going to concerts and you really love it, or don't even apply for certain jobs outside of your city because you can't fly there, right? Then it's becoming a disorder. It's limiting the way you want to live your life.
Okay, so we've gone over what panic disorder is. We'll take another question. So this one is how to work through triggers instead of just avoiding them.
Yeah, so as we were talking about how avoidance is such a big part of panic disorder, that's a really, really good question from one of your followers of like, how do you work through it instead of just avoiding? So the tendency that would really get in the way of living your life fully is to avoid situations that you're scared of or bring up panic attacks, right? And especially if you have a loved one who suffers from panic disorder or a lot of panic attacks, there might be a lot of avoidance behaviors that you guys both do together, right? Like, often people with panic disorder are prescribed anti-anxiety meds like benzodiazepine, so Xanax or something, and so they'll have their Xanax with them, and that's the thing that allows them to go on buses or trains, because they have that what we call safety behavior of like, okay, if I have one, I could just avoid having a panic attack by taking an anti-anxiety meds, for example, or I could just leave or something. So there's a lot of maintaining the panic disorder, right? In the best case scenario, even with best intentions, some people might actually maintain their panic disorder by having all these what's called safety behaviors, things that, ways to avoid, ways to avoid that fear. And maybe in the moment that would work, like if you just had to get on a plane and you don't have time for treatment, that anti-anxiety meds or some other thing, or helping that person escape would be the best thing to get through that moment. But as you can see, if you do that a lot, it becomes the disorder. You have to shape your life around avoiding it. And it gets worse and worse. So we've talked about this before, but the principle of treating any kind of anxiety is exposure, confronting the thing that you're afraid of. Over and over again until the person sees, like even in our lizard, the old primal fear brain, like in order to see that actually that thing is safe, and is not going to be deadly or catastrophic. So cognitive behavioral therapy treatments, by the way, work super, super well for panic disorder. It's not easy, but it's like relatively simple and straightforward to treat in therapy. So if anyone has a panic attack or panic disorder, go get therapy, because I've seen really debilitating panic disorder where the person barely could leave the house. They kind of just made it to my office. And then 5 sessions later, they're like, oh, I can actually go to the mall now. And,
that's amazing.
It's one of those things that it could change your life dramatically if you get treatment. So, and the treatment is simple. You, once you have an understanding of what panic disorder is, like we just talked about, then it's like, okay, what are the things that bring up that feeling of panic, right? So you might make a list of your heart rate going up, feeling out of breath, of course, then the gym, the walking upstairs, stuff like that. So you really think of all of the different things that might bring it up, and then you intentionally expose yourself to that thing. You intentionally approach them, right? With a therapist, they kind of walk you through gradually doing that from something that's easier, like spinning around in your desk chair in the office so you get that feeling of dizziness, or breathing through a straw, which could make you feel like you're suffocating. So you slowly expose yourself to all those triggers of the panic until you do it over and over again until the fear decreases over time. And then you work your way up to scary things like, okay, we're going to breathe through a straw in my office, get used to that, and then you're going to go into like a sauna like later on when you get more comfortable. So it's this gradual exposure to those feared situations that would help someone really get over that panic disorder. So I think it's super cool. But.
It's pretty well known in our work that panic disorder is one of the most treatable conditions by CBT, and so I would also encourage you to seek treatment or help your friends seek treatment. I think the safety behaviors thing is interesting because, I mean, even a follower said, like, keeping Xanax on me at all times is supremely helpful. And I kind of wonder, and you'll be better to answer, my first thought is, like, safety behaviors feel like an intermediate step for me, maybe. So, like, if someone is unable to leave their house because, they think they might have a panic attack, and keeping Xanax on them helps them leave the house and live a more normal life, then would you advocate for that as an intermediate step and then kind of work on taking away the Xanax over time?
Yeah, different therapists will say different things, and if it gets them to a therapy session, get them treatment, and gets them through a really challenging moment, okay. But knowing that that's not actually going to help their panic disorder, because in the back of their minds, and it might not be aware of it, they're thinking, okay, I'm terrified of having a panic attack, but I can only survive it because I have this anxiety meds in my bag, right? So it's this kind of trick. It's a crutch where actually the whole point of therapy is to teach them you can survive being on a bus or train or any of those feared situations without anything, with just being yourself. Even if you have a heart increasing, you won't die, right? And so having that crutch, having that other thing to like make you feel safe is actually it's a way to avoiding the reality, which is like you're going to be okay. So so actually like CBT therapists are pretty frustrated when they hear like, oh yeah, I could deal with those things, I just have to bring my Xanax or bottle of water. It's like part of the treatment is actually taking away those safety behaviors slowly. So
Yeah.
Another interesting part about safety behavior, I'm just learning through this with through a psychodynamic perspective, is actually panic disorder and panic attacks could have this really relational component, which is so interesting. Because there's often, with some people, having a panic attack or a panic disorder puts them in this role of being very, very vulnerable and needing help from people, right? Because it's this moment where they're totally out of control. And what that could kind of do sometimes is elicit help from other people. Yeah. Right? So you think about this, if you have a loved one who has panic disorder, what you tend to do. Like, do you tend to bring them the anxiety meds or reassure them or, come to their rescue, right? So in some ways, actually, panic attacks could be reinforced because it actually elicits help from others and allows people to take care of them. So I've seen a couple patients who've had panic attacks, and that was their first time that they've actually like been in a position where they needed help from their partner or whatever. Like often what happens is people who have panic attacks sometimes need to suppress or feel like they have to suppress their emotions. If it's the fear of fear, they're so afraid of their own fear that they're like, oh no, I have to push it down, and that makes the heart rate go up. But then for those people, they're like used to being in control, right? They're used to, not needing help or being very independent. And then they're super vulnerable, and it has this component of like help seeking without them being aware of it. So sometimes people with panic disorder tend to be people who have trouble asking for help from others. And it becomes like part of the dynamic. Yeah. So
do you think there's a way to be clued into that? Because it's such a fine line of, if Paul has a panic attack, I don't want to be like, well, you're on your own, because I don't want to encourage this. Like, I don't want to be inadvertently adding to your panic disorder. But sometimes that might be the case, that, I might be inadvertently adding to his panic disorder. So do you know of any way to kind of tell, to be clued into that?
I think through therapy, it's kind of, it's through understanding how what role that plays in a relationship. So kind of, noticing when someone has a panic attack, what do they expect from someone else? How do most people respond to it? Is that a component to the whole disorder, right? Like, is it hard to give up that kind of help, right? If you have a loved one who is having a panic attack, in that moment, of course, the natural thing is to try to help them, right? To reassure them. The best thing to do is the grounding techniques I talked about, which is attention to the present moment, like mindfulness, but mindfulness of your current sensations. So like feeling your feet on the floor, your body on the chair, or sometimes intense exercise, right? Like telling people to do the jumping jacks, running up and down stairs, right?
It's interesting because I think that would be opposite to what they would want to do.
Right. So actually, in a way, that's a little bit of actually bringing the emotion down, which is a safety behavior. So it's not a long-term solution, but when you feel intense anxiety or intense emotion, one skill that we do is intense exercise. So if you feel your heart racing, actually running to increase the heart rate, they don't know exactly why that happens, why it works, but they think it might be because eventually the body does calm down after exercise. And also it kind of puts it, you're not afraid of it anymore. If
it gives a more appropriate context.
Exactly. If your heart rate is racing because you're jogging up and down, it makes sense. If I'm just sitting listening to my supervisor and my heart's racing, it seems crazy. Yeah. So even really just, cool. They're not sure exactly how it works, but they know that, if you're feeling super, super anxious, doing intense exercise is one of the skills to help it calm down. But again, that gets you through the moment. It doesn't stop panic attacks before they start.
I won't go too deep here, but this does remind me of the almost philosophical debate in psychology about whether it's our mind that comes first before the physical sensations, or whether it's the physical sensations that clue us into our emotions. And so if our heart starts racing, one theory is like the racing heart comes first, and then we kind of contextualize that. Oh, my heart is racing because there's a tiger chasing me. But if you're running, you know, oh, my heart's racing because I'm running. So
Exactly.
that's pretty cool.
Yeah.
Okay, everyone, welcome back, Dr. Paul Seli. Hi, Paul.
Hello.
Hello. Thanks for joining us again.
My pleasure. It's the best podcast I've ever been on. I'll keep coming back.
That's right. Okay, so we've gone over what a panic attack is and what panic disorder is, but we want to hear about someone with personal experience. So can you describe kind of the scope of what you were dealing with
During a panic attack?
during panic disorder? So
Yeah. What was
journey
your
been with
experience
this?
of what a panic attack was like, and what happened when you started to have a lot of them?
Yeah, so I mean, it ties in with the other episode I was on with psychedelics, where I didn't realize until after the fact, but I had my first panic attack while on a lot of psilocybin mushrooms. And as I learned later, typical signs of panic attacks include, feeling like you're dying, feeling like you're going crazy. And I had both of those experiences, magnified by psychedelics.
Can you walk us through that moment? Can you walk us through well, I think you did in the last episode, but maybe the actual panic part?
Yeah, I'll do my best. I mean, it's always hard to put words on the experience, but I remember I was in my parents' bathroom and looking in the mirror while on heavy doses of psychedelics is maybe not the best idea ever. It's purely dissociative, at least in my case it was, where I was looking at an entity that wasn't me, and that really scared the shit out of me. And hovered over an abyss, and my limbs were spaghettified into it. It cut to the part where I was then in the fetal position in the shower, and just my brain, it felt like it was melting down, essentially. Like I couldn't, everything was overstimulating, even the water hitting me from the shower as I was laying down in the tub. And I've since had that with pretty much every panic attack, where it's just like you're sort of a prisoner of your own mind, where I would have my eyes open and the stimuli in the world were too much for me to take in. And so I would naturally close my eyes, but then my thoughts were too much. And it's just like, there's no escape. You've just got to kind of ride it out while you are convinced that you're dying and losing your mind. So yeah, that happened with my first psychedelic trip. And then I smoked pot for years after that and years prior to that. And it became part of my persona, I guess. And I guess it was quite naive about it, that most of the time panic attacks were triggered by smoking a joint. Not exclusively, but a lot of the time it sort of brought back these feelings that I had when I was tripping on mushrooms. And it was just such a part of my personality that, I mean, hell, you could probably do another episode on this, that it became such a part of me that even though it was doing this terribly scary thing, the scariest thing I've ever been through, a panic attack, it was just such a part of me that I couldn't let it go. So I knew that smoking weed was doing this to me, but it took years before I actually stopped altogether, and then essentially rid myself of panic attacks. So
Yeah, actually, for people listening, this is that's actually a special case called substance abuse panic disorder. So people, have a medication or kind of a drug experience, and as you can imagine, has all the, is associated with heart racing and feeling sweaty or choking or whatever. And then, if someone does that drug again, they might have a panic attack, or then you just associate, well, whenever my heart races, you start to have a panic attack. So, and it's common what you said, but you might not even be aware of what set it off in the first place until you really look at, at the pattern.
Yeah, it was so weird because, I mean, it's so physiological for me, at least, where it's all about, heart racing, sweaty palms. In high school, I got the Drama Award. I would act, do plays in front of, hundreds, thousands of people. I would MC events at school. I loved it. I loved being in the spotlight. But one thing I later realized after my first panic attack was that that you have physiological arousal when you're in these situations, right? Which I had previously interpreted as a good thing, like excitement, right? Ooh, I'm really looking forward to doing this thing. But now, my brain interpreted it in a very dangerous way. It wasn't exciting. It was, oh shit, I might have another panic attack. And so I ended up developing a phobia of presenting, which as a professor is an interesting thing, having to give talks every year. I mean, I've since overcome it. But yeah, the idea of defending my thesis and then after that giving a job talk was just a nightmare because, I would get physiologically aroused, my heart would start racing, and then I'd be terrified that I was going to have a panic attack, essentially.
You told me once that you almost developed agoraphobia. So can you talk about when it was getting that bad and what that was like?
Yeah, so I mean, I was suffering from panic disorder something like 15 years ago, and it's been a while. I mean, I still will have a panic attack or two every year, sort of thing. But yeah, back then I was having panic attacks probably every other day, if not daily. And was also pushing myself to do undergrad at the time. I'd just finished working at the car wash and decided to go back to school. And being in a classroom, I would sit by the door in case I had a panic attack because I needed an out. If there were any group activities, I was terrified to interact with other people. If I had to, I mean, I remember I had to back out of doing a poster presentation or doing a little presentation in front of the class. I had to step aside and chat with the professors and say, like, I'm just not capable of doing this. Is there anything else that I could do instead? And so I don't know exactly if there was like a particular trigger, but this fear of having a panic attack being associated with your, increased arousal, it just follows you anywhere. You could have it anywhere. And so it got to a point where I was just terrified of having a panic attack because they're frightening as all hell. And so, if I'm in my bedroom, well, this is nice and safe, but anything else is fair game for increased arousal and the possibility of having a panic attack. And I remember, I was taking psych courses at the time, so I knew about agoraphobia, and I'm quite grateful that I did, because I think that allowed me to just be like, nip it in the bud, where it's like, if I don't get a hold of this now, then I won't be able to leave my house. Like I won't be able to leave my bedroom for fear of having a panic attack. Yeah.
How did you get over it? I mean, like, you don't have panic disorder anymore, and you're talking about, like, okay, I have to get through this in order to live my life. So how did you do it?
Well, I guess I started exercising a lot, which helped. Gaining control in my life in healthy ways, like having a healthy diet, for example, helped a lot. Exercise, big time. The other thing that maybe seems a bit morbid to some listeners, but I don't know, to me, I was a double major in philosophy and psych, so I'm all about the philosophical side of things, but it made me think a lot about death. Every time I have a panic attack, I'm convinced I'm going to die. And that's the terrifying part, that you're going to go crazy and you're going to die. And so really I came to terms with dying. I mean, as best I could. It's not to say it's something I'm looking forward to, but I've spent a lot of time thinking about that, so that, that's the ammo that the panic attack has against me, is I might die. And it's like, well, if I'm content with the life I've lived, then when I'm going through this experience, if I can recall that, then this is really helpful to me. It's not as terrifying as it once was.
This had interesting implications for our relationship because early on in dating, Paul was like, I love you, and now I don't. Now I'm not okay with dying. This is actually dangerous.
Yeah, thanks a lot.
Did you have more panic? Did you have more panic attacks?
No, I didn't, but that's also true. Where it's like, I don't know.
Oh,
it's
that's sweet though.
Yeah, that's true love, right? I don't know. It's one thing to be okay with dying, without having to consider other people. But if you care about somebody else deeply, it's not to say I don't love my family or anything. Of course, I do very much, but. Yeah, there's something about wanting to, I don't know how to put it.
Wanting to live?
Yeah, well, that's why I'm concerned. Like, it's not as though I haven't wanted to live, even through panic disorder. It's not like I was suicidal. It's wanting to live in a particular way, I guess, where I suppose with Jacqueline, I have been more vulnerable, and that's been quite lovely. Like being open to the possibility of dying and that being a bit terrifying again, where it's like I don't want to lose her, and I don't want her to lose me. And if we were to ever have kids, like what a terrible thing. But yeah, fortunately, I've got enough time under my belt where I became okay with my own death. That despite the fact that it was challenging when I first started dating Jacqueline, I'm now okay with it, and it hasn't resulted in any panic attacks.
No, I think, Paul, you're giving a really interesting account of kind of the principles that we talked about before you came on, which is how one actually gets through and treats panic disorder, which we said exposing yourself, approaching situations that bring up the panic, right? The things that you're afraid of, confronting your fears, really. Yeah. And then doing that over and over and over again. And there's some acceptance, the skills that you develop is like this really complex acceptance of the thing that you're afraid of, which is the thought of death. So if you avoided it, which, like never thinking of death and, really avoiding all situations that would bring it, never driving past a cemetery or blah, 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 that actually might probably maintain your panic disorder. But you seem to have intentionally gone and done things that would bring it up, like exercising. Clearly you're a professor now, so you've done a lot of presentations, thinking a lot about death. So you intentionally faced your fears and seem to have gotten rid of the panic disorder as a disorder, right?
Yeah, one thing that was very useful with the presentation phobia, it was actually Dan Smilik, my master's PhD advisor, suggested this because he used to be terrified of presenting as well, and now he's just like the best presenter I've ever seen. He's just so engaging, and so he gave me tips. He wanted me to thrive, and one thing that he said that was super useful in the case that there is anybody listening who has a fear of these things, a similar fear. When I was practicing a talk, I would run up and down the stairs as per Dan's advice, and then my heart rate would increase, right? Which is typically a sign of panic or terror, where it's like, this is how it always starts. But now I'm in a safe context, right? It's just me at my computer, at home, or, in William James Hall at Harvard or wherever the hell I was. I would just run up and down stairs when I'm on my own. And then I would start giving the mock presentation while out of breath and heart racing. But through conditioning, it's like this, I'm in a safe place right now. This physiological sensation is not the end of the world, and it doesn't necessitate a panic attack. And it's just been so instrumental in getting me to where I am, where, now I'm teaching a class of 100 students, and I love it.
That's great.
Cool.
You just illustrated that shift that we look for in treating panic disorder, which is for when people come in with a disorder, they go, oh my gosh, when my heart races, I'm going to have a panic attack and it's going to be awful, right? Like heart racing equals disaster. But then approaching over and over and over again, making their heart race over and over again intentionally. First of all, they're getting control over it, right? They have a feeling of agency, right? But then also they learn over time, this is not going to lead in disaster. I could actually have my heart race. I could stand up and talk in front of a bunch of people, and I'm not going to have a panic attack and fall dead on the floor, right? So.
Yeah. I mean, I'm fortunate insofar as I never had a panic attack in that context. But I mean, I imagine I had when I was presenting, in grad studies. That would have probably been bad news for me because it would have convinced me that I'm incapable of doing this. But I think practicing things like running up and down the stairs, as I suggested, breathing deeply, and also confronting death, and okay, suppose I got to the point where it's like, okay, suppose I do have a panic attack. These people are kind and compassionate. Nobody is going to, it's not like the end of my career. They would feel terrible and probably try to console me after the fact, So just realizing that, this anxiety is something that everybody has to some extent, and I think people are generally quite receptive to and kind and considerate about and there to help. Really helped me, where it's like I can get into my mind about all of the what ifs, but I never used to think about the positive ones. Like, even if I did have a panic attack, it wouldn't be the end of the world. I'm a human, and we've all suffered through this sort of stuff. So.
You basically did CBT on yourself, because even when people say, oh, what if I do have a panic attack in front of everybody? Then, and they might, like, that might happen, especially if you're approaching it over and over. They might have a panic attack in these places. And then we go, okay, then what would happen? What would actually happen? Your anxiety mind says disaster, death, embarrassment, humiliation, rejection. But in reality, it's not as disastrous as I think. And when you lean into the acceptance and not avoiding it, right, that's how people get over it. So you just CBT'd yourself.
Yeah, I love CBT. One other thing, I don't know if there's any research on this, but I mean, I'm a good sleeper and I quite enjoy sleeping. I'll sleep at least 8 hours a night sort of thing. And I'm actually more inclined to have a panic attack if I haven't slept well, if I do like, an all-nighter or only sleep 4 hours or 5 or something like that. And my guess is because there are these physiological oddities, right, which my brain is just hypersensitive to. Why is my heart skipping a beat, which is more likely to happen if you haven't slept well? Why is my vision slightly blurry, or why is my brain behaving differently? And then it's like, something must be terribly wrong. And then the thought that something must be terribly wrong leads to increased physiological arousal, and that in turn leads to, hyped up thinking about it, and it's just this ruthless cycle. And so I found that getting a good night's sleep really, really helps because it minimizes these physiological oddities. So I don't know if there's any research on it, but
basically, we were talking about this earlier, but a panic attack is a fear of fear. It's a fear of your own physiological signs of something wrong or fear, right? So if you feel dizzy, then you get afraid of that and get even dizzier, or So if you actually, take care of your body and you have less of those symptoms in general, shakiness, heart racing, whatever, then there's less to be afraid of, right?
Yeah.
But it's two components. It's like taking care of your body so that you don't feel those feelings. But if you do, to also teach yourself that it's going to be okay, right?
Yeah.
So it's kind of like the two-pronged approach.
I don't know. Has the research shown, and sorry, I don't know like how important this is to mention, but I'm just wondering if the research has shown that panic disorder often leads to other disorders. Because I know with Paul, I mean, having an intense focus on his physical symptoms, like Paul, you're a little bit of a hypochondriac. And I feel like that also kind of fed into some of the separation anxiety that you were feeling early in our relationship. For others, it seems like it can lead to phobias very easily. Like, is this something that can breed other... Do we know?
Yeah, I mean, this is a lot of the work of David Barlow, who's a really amazing psychotherapy and anxiety researcher. But a lot of anxieties and other disorders in general are very comorbid. So with anxiety, they almost say, like, what's the point of having all these different kinds of anxiety disorders? Once people feel really afraid of something, then they quickly attach it and generalize that fear to other things, right? You have a fear of heart racing. Well, then you're going to have a fear of exercising. You have a fear of scary movies, right? And then it starts to balloon from there when it's really like the essential same mechanism. So, yeah, I mean, we know that psychiatric disorders are often comorbid because one problem will lead to another problem often, but especially with anxiety disorders, our ability to become afraid of something is super quick. Right? We learn very quickly how to be afraid of something, and it takes us a really long time to unlearn that. Not even unlearn that, but learn that it's safe again. So,
I mean, I'm just thinking about anybody listening, like, how could they help their loved ones through this?
I don't know. It's tricky. It's such a hard thing to communicate to somebody who's not had a panic attack what it is. I've noticed that a lot, and people will say, mistakenly say, "Oh, I had an anxiety attack," when they're referring to a case wherein they had, some anxiety over something, and it's just like a wildly different experience, I suppose. So, I think just trying to understand what it is and the severity of it would be helpful. Again, it's really tough if you haven't had the experience yourself, but it's a hell of a thing. Like it is. I've had panic attacks where I've said, and I'm largely a pacifist. And not pro-war or anything like that. But I have said to myself, I would rather be on the front lines of a war than have another panic attack because I feel safer that way, at least. It's just such a scary thing that I think, trying to understand it and and just to be there, Yeah, of course, it's tricky because I've had, exes who have been there when I've had a panic attack, and their instinct is to try to comfort me by, rubbing my back or something. But as I said, it's, for me at least, it's just overstimulation where like anything, lights, sounds, there's too much firing going on in my brain. So even just touching me is too much, too stimulating. So I think, yeah, we're just trying to understand it, I guess, would be the best.
Can you communicate while you're having a panic attack? Because I had one follower said that she squeezes her partner really hard, like gives him a really big bear hug, and that really helps him. But obviously that wouldn't be good for you. So are you able to communicate while you're having a panic attack what you need?
Yeah, minimally. I mean, it's certainly not at the level that I would be at,
Yeah.
communicative level I would be at without a panic attack. But I can say, like, don't do that. Leave me alone, as I'm in the fetal position and just just riding it out, just waiting for it to end. Yeah. Yeah. So I don't know. I think just focusing on trying to understand.
Yeah, I think what you're saying makes sense, and I mean, I guess I'm just thinking, summarizing tips in my head. But number one is always like get more information, right? Learn more, read about it, talk to the partner about what panic attacks are. Knowledge is power, so even just there.
Yeah.
Two, finding a good therapist for that person, and kind of going with the therapy in terms of if they're taking away safety behaviors, right? Like, don't, if one of their safety behaviors like holding Xanax or something, to like not just give it to them, right? So like kind of work with them on the exposure and the treatment. But I also think one thing that's huge for someone else to be there, therapist or a loved one, is to sit there and go, you're going to be okay. We know that emotions and anxiety don't last forever, and when you're in at least when I was in a panic attack, I was like, this is going to last forever. I'm losing my mind, and this is it. Yeah. So just having someone else be like, okay, you're going to be all right. You're going to get through this. This is going to end eventually. Yeah. Can be helpful. That could be some kind of reassurance, but it's still fostering that acceptance and approach, and not like, oh, let's get rid of this. It's like, all right, we're here. You're feeling it. It's terrible. Feel your feet on the ground. Let's do some jumping jacks. This will be okay. Just give it an hour.
Yeah. Yeah, I don't know. I'm not sure how receptive I would be to that. I think it just depends. It's case by case scenario. I have the lovely ability to convince myself that even though every time I've had it before I've survived, this is the one true time where I will die. And so you telling me otherwise isn't helpful.
Well, maybe we'll try it out. We'll try it out in person next time.
But well, this is precisely why I got to the point of, okay, I just have to be okay with dying, because that's the solution, right? Because even if this is the time, because as I said, I can do these mental gymnastics where I convince myself, well, you're getting older necessarily from relative to the last time that you had one. Yeah.
It's just funny to see his brain work.
Yeah. Yeah. So I don't know. For me, it was just the acceptance of death, essentially, that I needed, because, nobody else could do it for me, because I could do these mental gymnastics where it's like, well, this is the time. You might actually be going crazy this time. Like, there's a first for everything,
Yeah. So instead of avoiding approach, that's the biggest tip.
Yeah. For me, and I think it depends on the person, I did more of a systematic desensitization approach, which was hilarious in retrospect, where, for my first talk, they called them brown bags in grad studies, where I had to give a talk in front of all the faculty and the students in the cognitive neuroscience department. So I don't know, like 40 to 50 people sort of thing. For the first talk, my girlfriend at the time was there, and it was just in the room, like in the context where I'd do it. I'd booked out the room, and I went in there and I gave the talk to her. And then the next time it was like 3 people. And then the next time it was like 5 people. And I remember Dan Smilek, my advisor, at my last practice, I must have had like 60 people there. I just built my way up. And he's like, Paul, you have more people here than will actually be there for your talk. But it was true. But I had just gradually built my way up to the point at which I was comfortable with it. And then I rocked my talks. I did really well with my talks. Like, I won awards for them and stuff, much as I was terrified. But that procedure worked for me, the systematic desensitization, just building up. Yeah.
All right. Well, KB, sign us out with some resources.
Yeah, thanks so much, Paul. That was a really good example. You really also illustrated what it's like to work through and treat panic disorder. You did it yourself, but for people who, need extra help, CBT, a CBT therapist would do exactly the thing, would guide you through exactly what you did. So thank you so much for that. That overview of how you work through it and your experiences. I obviously learn more about panic attacks and panic disorder. It's just such a debilitating disorder, but it can be treated so quickly. If you're looking for treatment, one really good one is called the Unified Protocol. It's developed by David Barlow and Boston University and that group. So that's really one of the industry standards for treating anxiety disorders and especially panic disorders. So look up Unified Protocol. David Barlow wrote a really good book. It's called Mastery of Your Anxiety and Panic. It's in the Treatments That Work series. It's written by David Barlow and Michelle Krask, two of the superstars in our field in anxiety disorders and treatment of anxiety and panic. So check that out and look up a cognitive behavioral therapist for help with panic disorder. So
just a quick note. So I want to acknowledge that we talked about CBT being the gold standard treatment throughout this episode, and then we mentioned the Unified Protocol. The Unified Protocol is a CBT. So CBT, it's more like CBTs. There's a whole umbrella term for all of these different treatments that use CBT principles and approaches. So thank you all for listening. As always, please rate, review, and subscribe. We love your comments on the review sections. Those give us great life. So we will see you back next week. Thank you. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.